Hello, my name is Samantha Young. I am a student of physical therapy at Franklin Pierce University, and this is the last of the videos in our video series regarding lymphedema. And this is a presentation specifically focusing on risk reduction guidelines. So there's going to be a lot of information that we're going to cover here, so we will go ahead and get started. So to go ahead and start us off, the who, what, where, when, and why regarding risk reduction guidelines. The who is anyone at risk for lymphedema. It's never a bad idea to meet with a treatment provider who is knowledgeable on this risk to discuss your personal strategies for risk reduction. The what of a risk reduction guideline is reasonable actions and precautions based on your anatomy and physiology. Where this is done all over the world, when this is a lifelong process, and it is good to make sure that we are paying attention to it now and we keep this knowledge in our knowledge bank for later. Why? We do this to reduce your risk for developing lymphedema or potentially making it worse. So 40% of women who are treated for breast cancer will develop lymphedema. However, there are some unavoidable, which means we cannot change those, and modifiable risk factors. So the modifiable are the ones that we definitely want you guys to pay attention to. So the unavoidable ones, which just means that you're at a greater risk, but it's something that we need to be aware of, is breast surgery. So this is what we mentioned in that first slide regarding the fact that a lot of people that have breast surgeries may develop lymphedema. The removal of the lymph nodes. Lymphedema is swelling of your lymph nodes. So anytime you remove those, it will produce swelling in the area. Radiotherapy and chemotherapy will also increase your risk of developing lymphedema. However, your modifiable risk factors include obesity, weight gain after your diagnosis, minor upper extremity infections, injury or trauma to the affected limbs, which could be either your upper limb or your lower limb, or the overuse of your limbs. So all of those I just listed are modifiable, meaning that you can make a difference to reduce those risks. All right, so we're moving on to the actions and precautions that you can consider. And we specifically targeted the National Lymphedema Network article. So everything that we are referencing here will be attached in that article, and it is at the very end. So if you would like to go through it yourself, we do have the link in our reference page at the end of this presentation. So please feel free to go ahead and just look that up yourself, read through that, and then you can ask any questions regarding that article to your primary care physician. All right, so talking to your doctor or your PCP, which is your primary care physician. So you want to make sure you're doing a lot of medical checkups. So this will potentially help with reducing your risk because you're going to be doing a lot of screening for lymphedema. And you need to know the signs and symptoms for early detection. We've gone over quite a bit of those already in the previous videos, so please make sure you're referencing those again in case you need a refresher. And make sure that you're following up on your schedule based on your individual situations determined by your care provider. So you guys will have a kind of like a task force schedule, and you want to make sure that you are following up on those with your provider. And then you do also want to make sure that you're reporting changes of your at-risk body part. So this is either your upper extremity or your lower extremity, meaning your upper arms or your lower legs. Make sure that you're looking for any increased size, any change in sensation. This one's really important. So if you're putting on your shoes and you just notice that maybe you're feeling one foot a little bit more than the other, this is something that you definitely want to write down and make sure that you remember to mention to your physician. If there's any change in your color of your skin, in the temperature of your skin, or your skin condition. So all of those you definitely want to be paying attention to, and any time that you think something may be going on, write it down. Make sure that you're talking to your physician regarding these, because if there's nothing there, then there's nothing there. However, if you do note these down and you talk to your physician, you might be able to catch it a little bit earlier. And that is the goal of all of this, is to prevent the risk of lymphedema. Okay, so moving on to staying active and healthy. This is very important. So your body weight, obesity is a major risk factor as we have already gone over, and that is in one of those modifiable risk factors. So this is something that we can modify and is important to keep track of. It's really important to maintain your normal body weight and seek professional help for weight loss. And this can be definitely with an exercise regimen, with maybe a nutritionist talking about your food intake. There are many options to go ahead and address this. So stasis, this is basically sitting down or standing for a really long period of time without changing position. So this is sitting on the couch and watching TV for a long time. This is standing in the kitchen for a really long time without reprieve. So basically any time that you find yourself in one position for a long amount of time, you need to go ahead and start moving around. You do want to avoid this because swelling will occur. And with impaired lymphatic drainage, you may have difficulty removing that excess fluid that has swollen up. So exercise, this is really important as well, as I mentioned with the body weight section. So you definitely want to make sure that you are not doing any incorrect or unsafe exercises that might increase your risk. And you can definitely ask for more clarification with your physical therapist regarding this. Your weight training and controlled supervised environment is really important. Weight training is a key factor to this. And then having a safe exercise routine with your physician or your healthcare provider will go ahead and help guide you along completing these exercises safely and effectively. And exercise can have a huge impact on all of those modifiable risks that we referenced earlier on. So this is a very, very important part of your healthy lifestyle that you need to be aware of. So this table is a great reference. This actually compares survivors of breast cancer who are at risk for lymphedema, meaning that they have not been diagnosed with lymphedema yet, as well as a population that has lymphedema. So what it's doing is it's comparing these 6 exercises and the suitability, or basically the appropriateness for a particular person to be doing these exercises. And as you can see, out of the 6, there are yeses, meaning that it is suitable for both the pre-lymphedema and those diagnosed with lymphedemas to participate in these exercises safely. Compression garments and constriction. So this is necessary after your diagnosis of lymphedema, and these compression sleeves will reduce your symptoms of lymphedema, such as reducing pain or swelling. And so this is very important for people, especially when they're traveling via a plane, because the low cabin pressure can increase your venous blood clots. So you need to be wearing these compression sleeves if you're doing any air travel on those affected limbs. You do have to get properly fitted for these. It is something that can potentially be a problem if not fitted correctly. So when you're ready to go ahead and get that constriction garment, you do need to be fitted for this. So make sure that you go to your primary care in order to get this figured out for yourself. And excessive constriction is also potentially coming from ill-fitting bras or clothing. And this is something that you do need to be aware of and make sure that if your limb, say your hand or your right arm, is starting to get swollen and your wash isn't fitting correctly anymore, you do need to probably take it off and make sure that you're wearing these garments, because we do not want to create any sort of constriction where there should not be. So these garments are going to help reduce the symptoms. However, that doesn't mean that we want constriction at other areas of your body, so such as the bras and the watches. Make sure that you're taking those off. Your skin is the largest organ in your body, so it's really important to make sure that you are caring for it and being aware of any signs of infection. You do need to moisturize your skin as much as possible with water-based low pH moisturizers, and this should be kind of everywhere in your body, but definitely focus on those limbs that are affected by lymphedema. Your proper hygiene is crucial in preventing infection. So this means that you do have to make sure you're washing your hands, you're washing your body, because any fluid buildup on your skin can cause dryness and irritation, and that will increase your risk for infection. So make sure that you're keeping your hands moisturized, making sure that you're wearing gloves when you're cleaning or doing chores, and anytime that you're shaving your legs or your armpits or anything else, make sure that you're using brand new clean razors in order to limit the chance of infection. If you get an infection, these are very urgent. So you need to make sure as soon as you get an infection, you go ahead and contact your PCP and treat that infection as quickly as possible. The signs that you should be looking out for is redness, warmth, pain, fever or flu-like symptoms. Now, if you've had infections prior, then you probably have a good idea of what you should do to start treating it. Just make sure that you are continuously keeping your primary care physician in kind of the ropes of what's going on with your skin once you develop lymphedema. This slide is very important as well. These are all important. So things to avoid. You do need to avoid extreme temperatures. So make sure when you go outside, you're putting on sunscreen. The sun is definitely very harmful to your skin, so you need to protect it. Anytime you're going to be near the stove or in the oven, make sure you are using oven mitts. And then if you're trying to fry any food or boiling or using a microwave, those dishes will become very hot, and that oil that is being in the fried food is very warm as well. So make sure that you're wearing long sleeves for protection, as well as using gloves or a towel to get some hot items out of the microwave. Avoid hot tubs and saunas, and using an ice pack for too long. Now, some potentially traumatic situations include falls, fractures, burns, getting any shots or IVs. If you have scratches or punctures or skin breaks, make sure you wash those with soap and water immediately and apply an antibacterial to make sure that you reduce that possibility of infection that we talked about in the previous slide. Any nail work, the toenails may need to be trimmed by a podiatrist. So make sure that you are maintaining your nails. This is important because it can scratch your skin and then once again make you more susceptible or at risk for developing an infection. And anytime going back to the shots and IV insertions, make sure that that's in a non-at-risk limb. Now, once you develop lymphedema, that will be in your medical records. That will be something that your doctors and nurses can look at. It's just important, just for your own peace of mind to go ahead and just say, I have the lymphedema in said limb, and I just would like to have my shots in this other limb. All right, so almost done. So in conclusion, all these guidelines need to be adjusted to you personally and with a specialist. So all the ones I've mentioned and anything we've said in the previous videos, know that it varies per person and it's not strict guidelines for yourself. But those guidelines that are developed for you by your specialist or physician do need to be followed for your life. There are a lot of people that have gone through this or are going through this, so make sure you're reaching out to any support groups, any friends or family for support. And I have a last few things to go over just as a wrap up of everything that we've gone and talked about. So air travel is safe. Just make sure that you are wearing a compression garment. Blood pressure cuffs have been a main concern for a lot of people. It has not been shown to increase your symptoms. However, you can always ask for your blood pressure to be taken on a different limb than that has the effective lymphedema on it. Mammograms will not cause or worsen lymphedema. So you might still have tenderness after a mammogram, but it will not increase your risk of developing or progressing your lymphedema. Like I mentioned before, razors are very imperative to make sure that you are monitoring how you're shaving, you're looking at your skin, making sure it's a brand new clean razor, and then make sure that if you do shave that you're not shaving around areas that have severe lymphedema, meaning that there's any large skin folds or wounds or even deep creases. And as I mentioned before, hot and cold, it is okay in moderation. However, that extreme heat like saunas or hot tub or having a really cold pack on for a long amount of time is not good. So make sure you're just monitoring your skin after you use any hot or cold device to look for that swelling and redness or rashes. And then if you go to the hospital or the doctor's office or medical facilities, just make sure that you do know that they will have your at-risk limb on record. So they will be monitoring that risk limb all the time for you. So after your surgery, they're going to know which side you had their surgery on, what limb they should be aware of. However, they will also still be monitoring everything for you. So it's not just going to be specific to one area of your body. It will go ahead and they will address everything that could potentially occur with you, because obviously this is a big concern and we want to make sure that you feel comfortable and confident afterwards. And if you have any concerns Or if you want just more clarification or information, just make sure you go to your healthcare provider. And please make sure you remember to click on the link below in the description of this video. We need you to complete that questionnaire. It's going to probably take about 5 minutes for you to do so. And just make sure that, if you ever need to go back to this, because it's a lot of information, it takes quite a bit of time to get through it, it's always here for you now. And you can always reference this again or tell your friends and family about it so that maybe they get a better understanding of lymphedema. But overall, I hope that all this video series was really helpful for you. And like I said before, we have on this last reference sheet, that second bullet was the National Lymphedema Network article that we did a lot of this research on. So go ahead, and if you want, you can copy and paste, or you can just copy that URL over into Google and it will send you right over to that article so you can read it yourself if you would like. All right, thank you for listening. That is it. Thank you for your attention and your time, and I hope you have a great day.